Hi everyone, welcome back to the Orthodontics training protocol. It's Jamie again, and we have Dr. Lipp here with us. So Dr. Lipp, what are the goals of today's module?
Well, I just want to backtrack to what are the overall goals of our series of modules. So where are we going? You know, we always have a goal and objectives to structure where we're going. Our goal is primarily to impart skills so that you can counsel your patients. The area that we're talking about is malocclusion and associated skeletal problems. Specifically, the objectives are going to be to report the conditions that your patients have that present with appropriate terminology, standard terminology, and the skill of diagnosis to be able to diagnose malocclusion and associated skeletal problems. Where this is coming from, where this material is coming from, is it's been adapted from materials that I developed over years at NYU in part of a competency-based training program. We assess competence using clinical simulations, which are basically composite photos of pre-treatment records. And they have intraoral photos, extraoral photos, panoramic radiograph, and cephalometric radiograph, lateral cephalometric radiograph. We also have 5 prompts that we use to assess competence. These prompts are, can you identify malocclusion? Can you identify an associated skeletal problem, meaning a skeletal condition that has clinical significance? It relates to an aspect of malocclusion. Can you propose a treatment plan or a list of services to remedy the conditions that you've diagnosed? And we do cover space management as well, which will be slightly beyond the scope of this first series of modules. We've also developed a list of evaluation criteria which guide the learner in the process of attainment of competence and standardize the scoring or grading of assessments. So this is what's expected of the learner. This list of conditions, we expect the graduate to be able to accurately identify these conditions when present, and that is part of our assessment and our concept of competence. So we're going to introduce the patient examination process, which is the structure, the 5-step structure that is very helpful in guiding the skill development. And we're going to mention the 3 planes of space.
Before we jump into the 5-step process, we want to talk about the planes of space because a lot of students, myself included, when we first learned about it, we had trouble really orienting ourselves in the planes of space, the 3 planes of space used in orthodontics. So could you elaborate a little bit about the planes of space for us and then why it's important in the process?
Sure. So everything that we're trying to report or describe that our patient has, whether it's occlusion, malocclusion, skeletal problem, any condition of the face, it's very important to break up these 3-dimensional objects into the 3 separate planes of space. So vertical is up and down, sagittal is front and back, and transverse is width, the width of the arches, the width of the face. When we look at the front view and we're focusing on the incisor occlusion, the anterior occlusion, that would transverse would translate to midlines, right and left. So this is very important to be grounded in what these terms mean, because we'll frequently be referring back to these planes of space, vertical, sagittal, and transverse.